So we're going to go to prevention of breast cancer and recurrence. Okay, so animal dairy. And again, this isn't just cow dairy, it's goat dairy, sheep dairy, buffalo dairy. The big reason, and it's interesting because I talk a lot about dairy when it comes to skin. I see a lot of acne patients, and in animal dairy is a little bit, in this context, a little bit different. So dairy has two components, just to be very simplistic. You have the fat, which is like the cream part, and then you have the whey, which is the non-fat part, or the water part. Our female hormones are fat soluble, and our male hormones, androgens, testosterone, are water soluble. So specifically, if you're having animal dairy, and if you're having animal dairy with a high fat content, you're, by its very nature, are going to be getting a lot of estrogen. And all animal dairy has a lot of hormones, and it has hormones for a reason, because it's basically giving a baby cow, a baby sheep, a baby goat, basically giving it some hormones, giving it nutrients. And if you're someone who is has hormonal issues, definitely don't want to be introducing any foreign hormones. And this is, I mean, that would be just even organic dairy. And then if you're looking at conventional dairy and pollution, and also fat, just fats in general, like to absorb more toxins, very, very problematic. The little last piece about this slide, eggs are not dairy. I get this question all the time. They just happen to be sold in the same aisle, but I get that question all the time. So, so definitely using vegan sources, things like almond milk, oat milk is very big right now, vegan sources, or no dairy at all. Okay, alcohol. So alcohol is very problematic. And the reason being is because of its effect on liver detoxification. And if you're a woman who has a family history, has significant risk factors, my suggestion would be not to have alcohol at all. If that feels insane, I will typically usually steer women to no more than 1 drink per day, and no more than 3 times a week. That's still, I mean, it's, some would say that's conservative. If you have very bad risk factors, I would definitely recommend avoiding alcohol altogether. And it's also kind of interesting because I think sometimes like France gets a very high reputation when it comes to a lot of like cardiovascular disease and everything like that. And they all say, oh, because they drink so much wine, blah, blah, blah. Actually, they have very high instances of breast cancer, actually. I don't think that they're the lead in the world, but they do have a very high incidence. So just something, again, to really consider. Okay, so omega-6 fatty acids, basically they're in, prior to, I guess what we call like industrialized farming, most people had a diet higher in omega-3s versus omega-6s, almost, or relatively equal. Where omega-6s really came into play was when we converted our pasture-raised animals to a grain-based diet. Problem with omega-6s, specifically coming from, when it is coming from red meat in the form of arachidonic acid, it's highly inflammatory. It can definitely help promote the growth of tumors. There's other oils too, plant-based oils that are high in omega-6s, sunflower oil, soybean oil, corn oil, really as much as possible to avoid these whenever we can, because basically our diet is so prevalent with them, or making strategies to boost up our omega-3s, which is in my next slide. And so the foods that are really high in omega-3s, your deep ocean fish like salmon, Walnuts are a really good source, flax seeds, hemp seeds, chia seeds. So really as much as possible, building up the omega-3 fatty acids. Grass-fed beef in comparison with conventional raised beef has actual omega-3 fatty acids just by the fact that it eats grass. And then of course, as we mentioned before, the benefit of taking a fish oil supplement. And if you're a vegan, there are actual vegan omega-3 products on the market that are derived from sea algae, and they actually have, they're a bit pricey, but it is possible to have it. So I know that we have mentioned the ketogenic diet while you're going through cancer treatment. The Mediterranean diet, on the other hand, can be a really good strategy for prevention. One, because it is promoting more of these omega-3 fatty acids from fish and nuts, and then also just beneficial oils, things like olive oil, avocados. There's also a big emphasis on fresh fruits and vegetables, whole grains, really supporting antioxidants. Another key component, if it's ideally followed, abstaining mostly from refined carbohydrates and sugars is also going to be beneficial, because again, if we think about back, one of the reasons why the ketogenic diet was so beneficial is the reduction in glucose. Well, just having reducing anything that's going to be causing massive insulin spikes, massive increases in blood sugar is going to definitely be more beneficial when it comes to the prevention of cancers.